Now let's start with drugs for Parkinson's. So Parkinson's disease. What is this problem? First of all, try to understand what is happening, what is wrong in Parkinson's disease or Parkinsonism. So we have what we call as a place or a region in CNS that we will call as substantia nigra. So substantia nigra, from this a neuron will originate. A neuron will originate in substantia nigra, and this neuron will go to a part of CNS that we call as striatum. So this is called as Nigro-striatal pathway. Okay, Nigro-striatal pathway. This neuron is going to release dopamine. So this is a dopaminergic neuron. Dopamine is released in striatum, and this dopamine is going to control an acetylcholine or cholinergic neuron. So the dopamine which is released will keep in check the acetylcholine neuron. Ultimately, from this pathway, an impulse will go to muscles and joint. Okay, this is the pathway. So Nigro-striatal neuron releasing dopamine in striatum controls the cholinergic activity, and ultimately from this pathway an impulse goes for the control of muscle tone and joint position. Now due to any reason, it may be age, it may be some environmental toxin, it may be free radicals, death of this neuron occurs. So this death of Nigro-striatal neuron, what will happen? This would cause dopamine deficiency, decrease in dopamine action in the striatum. When dopamine deficiency will occur, as you can understand, the control on cholinergic neuron will reduce. So it will increase the acetylcholine or the cholinergic activity. So dopamine will be less, so control on acetylcholine or cholinergic neuron will go away, so acetylcholine activity will go up. Because of these chemical problems, because of these neurotransmitter issues in CNS, patients will develop muscle rigidity. Patients will develop what? Muscle rigidity. Patient will develop slowness of movement called as bradykinesia, and patient will develop resting tremor. At rest he will have tremor in the finger. At rest he will have resting tremors, and this is what we call as Parkinson's disease. So what is Parkinson's disease? The cause is death of Nigro-striatal dopaminergic neuron. This neuron is dying. We don't know the cause. It may be because of age, it may be because of some toxin, it may be because of free radical or something else. But this neuron dies, less dopamine is released in striatum. When less dopamine is released, cholinergic activity goes up, and these neurochemical abnormality lead to muscle rigidity, bradykinesia and tremor. These are the three principal symptoms of Parkinsonism. So that is what is the disease. First of all, we have to understand the disease in order to treat it. So I hope it is clear. Nigro-striatal neuron की death हो जाएगी, dopamine की deficiency हो जाएगी, muscle tremor, rigidity, bradykinesia होगा. That is called Parkinsonism. Now we come to the treatment of Parkinson's. So drugs for Parkinson. Now what is the cause? दो cause हैं, decrease dopamine and increase acetylcholine action. So what is the treatment? treatment is also twofold. Number one treatment, we can block acetylcholine action in CNS. So we have central anticholinergic drugs. Central. These drugs will block acetylcholine action in CNS. Central anticholinergic. Central anticholinergic. The drugs we have discussed many times. The drugs names are like benztropine, benzhexol. Benzhexol is also called as trihexyphenidyl or biperidine. These are drugs that will block cholinergic action in CNS. They will block cholinergic action in CNS. So central anticholinergic. What is their benefit? See, there are three symptoms: tremor, then rigidity, then bradykinesia. There are three symptoms in Parkinson's. The maximum improvement with anticholinergics occurs in tremor. So improvement, if you look at improvement or benefit by giving these drugs, so maximum benefit occurs in which symptom? Tremor. Okay, so they will benefit tremor the most. Maximum improvement will occur in tremor with these drugs. What are the uses of these drugs? When do we use these drugs? Use of these drugs in Parkinson. Now please focus. Number one, idiopathic Parkinson. Idiopathic Parkinsonism. That means we don't know the cause. We don't know the cause of that Parkinson, why that Parkinson has developed. Idiopathic, we don't know the cause. Then these drugs, anticholinergics, are simply add-on drugs. They are add-on drugs. So patient is receiving levodopa therapy. You can add these drugs if patient is not controlled on levodopa alone. So they are add-on drugs and they will maximum benefit which symptom? Tremor. So mainly they are added to control tremor. But there is another kind of Parkinson that we have discussed in antipsychotic extrapyramidal side effect, that is called as drug-induced Parkinson's. Now focus on the word drug-induced. What is this? Which drug have induced Parkinson? It is nothing but antipsychotic. Patient is a psychotic patient who is taking a D2 blocker, and due to D2 blockade, patient has developed extrapyramidal side effect of Parkinson. So this patient, please remember, is taking a D2 blocker or antipsychotic. Those drugs have induced Parkinson as a side effect.